We have very little culture of prevention. The patient goes to the doctor or the nutritionist only when they are already sick. And yet, we will have to work on it. And nutrition has a very broad field here, starting from prevention, from knowing that I am fine now, but that I have these predispositions, knowing how my microbiota is, regardless of whether I have major digestive problems, but perhaps I do feel bloated, maybe I have distension, and I have alterations in intestinal transit. And that is causing me to not have a healthy microbiota, which is affecting my immunity and leading to more allergies, for example. I don't necessarily have any serious pathology that needs treatment, but I can start working on that. When we talk about immunonutrition, we are looking at the relationship between our way of living, not just what we eat, but our overall lifestyle. Our immunity relies heavily on microbiota, which is the main protagonist. 70% of our immunity is in our microbiome. It is a fundamental modulator, and our first line of defense when any pathogen or toxic agent enters through our mucous membranes. The first thing that must deal with these agents is our microbiota, which is why it is so important to keep it strong and to work on it properly. And logically, it will be closely related to our endocrine system, nervous system, and immune system. These three control systems of the body that are so important, and how we eat with an anti-inflammatory nutrition that must include micronutrients, a correct balance of omega-3, and must be a diet, as I said, rich in antioxidants and low in refined sugars, which is anti-inflammatory, and we will talk about that. So these schemes, also so that you have in mind during the consultation where we are going to work with our patient, what points we are going to address when making a good diagnosis and a thorough nutritional history. Here I present to you, well, in the diagnostic studies, this is all somewhat the same, but explained in different schemes that I use for my nutrition teams, a bit to teach them how we are going to work with the patient, right? To say, hey, we are going to work with them. All patients are assessed based on their body composition, not just those who want to lose weight. If a patient comes to you with digestive problems and starts losing muscle mass due to their diet, we are doing something wrong, and we need to work on that aspect and improve their protein balance and carbohydrate balance so that they do not lose muscle. In the complete analysis, we will measure kidney function, liver function, hormones, and vitamins. Vitamin D is very important. Inflammation factors, erythrocyte fatty acids, to see how the balance of omega-3 and omega-6 is, are important at the level of inflammation. The study of microbiota is fundamental, where we will see not only how the microorganisms in the intestine, bacteria, fungi, yeasts are doing, but also their metabolites and how intestinal metabolic function is performing, especially if I am very low in short-chain fatty acids, for example. We need to enhance them. These are metabolic alterations that will depend on the state of my microbiota, but if I know them, then I also understand which functions we are not performing efficiently. Our digestive functions are also fundamental, and then at the nutrigenetic level, as I consider what risks I have when it comes to health prevention. In nutrition, we will work on the clinical aspect of how the patient is doing. However, many patients come simply for prevention. They come because they already know that their nutrition will help improve their future health and make them feel better. There doesn't have to be a pathology. In fact, it should be this way. In Spain, we certainly have very little, and I believe that in almost all developed cultures, we have very little culture of prevention. The patient goes to the doctor or the nutritionist when they are already sick, and yet we will have to work with them. Nutrition has a very broad field in prevention, knowing that I am fine now, but that I have these predispositions, understanding how my microbiota is, regardless of whether I have major digestive problems. However, I might feel bloated, have distension, or experience alterations in intestinal transit, and this is ultimately affecting my microbiota health, which in turn impacts my immunity and leads to more allergies. For example, I may not necessarily have any serious pathology that I need to treat, but I can already start working on that. And thanks to the fact that we are spreading all this today, hormonal imbalances, allergy problems, and dermatological issues are being addressed from within. More and more patients are coming to work on this from a preventive approach rather than simply taking a patch or a medication that regulates him. For example, I see a lot of hormonal problems that regulates him hormonally, but in the end, his problem of premenstrual syndrome, for example, is conditioned by inflammation, because in the end, it has intestinal dysbiosis and elevated cortisol levels. When all of this is addressed, it improves completely, as these are ultimately certain problems that have an inflammatory nature. This is a scheme that I'm showing you. This is what I said I would send you. I put it here because, well, I actually did this for my colleagues. I work in a trauma clinic, and I find it very difficult to explain to doctors, sometimes to the traumatologists, how they can detect in consultation that a patient has certain problems that can be addressed through nutrition. And how we are going to address it through nutrition is something very simple but very visual that I want you to have, because in the end, if a patient has dermatological issues, a traumatologist may not necessarily address them, but if we are multidisciplinary teams, the nutritionist is there and sees that the patient has a lot of sensitivity, has eczema, has histamine reactions, and has significant skin redness. You can ask and know that nutrition will be worked on. We are going to study the microbiota, conduct a complete analysis, and see if stress also affects it. All of this will be addressed through lifestyle and nutrition. So I created this scheme so that in the end they would know a little more, and it has been very useful in a multidisciplinary team to identify what things we need to work on or may be related. However, logically, for example, in digestive problems, I did not mention that it should be done in a stress study, and many times it needs to be done. But at least having that perspective of the patient and telling them, if you have these problems, if you have abdominal distension, constipation, gas, and they haven't treated you, and the digestive tests, endoscopies, and others are all fine, it can be improved. In other words, you don't have to live with those problems. They can conduct a microbiota study, check for food intolerances, and see what needs to be treated, how the ecosystem is, and how to strengthen and improve it. I did this a bit to detect those imbalances that ultimately appear in our patients, which are not related to nutrition, but that we can refer to nutrition because they will improve. And because we have to work as a team as well, a dermatologist is the one who will address those dermatological problems. But if they see that nutrition is approached in an anti-inflammatory way, helping to improve their microbiota, then surely the skin will improve. And that, well, working as a team is very important. So that's why I included it, because I thought it was interesting, even if it's a bit basic, but very visual, and to see everything that needs to be seen in these patients, or some of the things we will have to look at. Then, logically, with a good medical history and a thorough assessment, we will see what studies need to be done. Not everyone has to be in these protocols. Well, sometimes these guides are useful to know what tests and studies can be done. Something very important to consider, and that can be studied, is cortisol levels. What we analyze in saliva is the balance between cortisol and DEA, which ultimately is the hormone that will compensate for the harmful effects of cortisol. And that it is important to see how the balance is between both, not just to measure cortisol in the blood. So this can be done, and we do it with saliva studies. Elevated cortisol levels when there is a lot of stress produce a catabolic situation, increased blood glucose, decreased defenses, sometimes chronic pain, and hormonal changes. Well, many times problems are the trigger. For example, they come to you because of a problem due to a dermatological issue or thyroiditis, and the trigger was a stress problem. It is true that this pathology can become chronic, but ultimately this hypothalamic and adrenal axis needs to be addressed. How are we going to work on this from nutrition? The next question? Well, many times it is necessary to refer to a more psychological approach. But there are certain supplements, in this case indeed supplements, that will help us. For example, the vagandas. Vagandas are an adaptogen that will help us modulate cortisol levels, provide this patient with B vitamins, magnesium, and also help improve, for example, sleep. It will also be very important, and this can indeed be addressed with supplementation for our patient, as well as avoiding all types of stimulants and added stress in the diet, such as the consumption of ultra-processed foods and refined sugars. which will contribute to increased stress. We need to improve the microbiota because it is likely affected due to these high stress levels. In other words, knowing this about a nutrition patient will also help us establish guidelines to improve their diet and provide supplementation. You have a module that addresses more of the psychology aspect of the nervous system, and it is very interesting because ultimately, anything related to neuroprotection and modulating our stress levels is also fundamental for improving many clinical issues, for example, at the intestinal level. A clinical history, an example, for instance, a fertility problem. We are going to look at all of this here. We will analyze coagulation issues, and homocysteine is fundamental and often not analyzed in patients, even in fertility treatments. I recently had a patient who came from 2 in vitro fertilization treatments and was having miscarriages, and they had not. Having analyzed homocysteine, it was found that when we have high homocysteine levels, we have a greater predisposition to thrombosis. Platelet aggregation has a very high oxidative potential, and we know it is related to miscarriages. The solution was to lower homocysteine with methylated B vitamins, of course, because normally the problem is a genetic issue. I have included here the genetic study we need to conduct when we want to see if there are methylation problems, as we cannot properly activate those important vitamins to lower homocysteine, and we need to provide the mother with methylated vitamins. And this is very common in our population, and many times methylated vitamins are not given, so they do not activate properly, and I say it is a factor that is often elevated. Right now, COVID also alters all these coagulation factors. Many times our homocysteine levels rise, and this needs to be taken into account in a clinical history for a woman, for example, who is going to undergo fertility treatment. Overall, in nutrition, we will take all of this into account because everything improves through nutrition and, of course, with an anti-inflammatory diet. We will look at inflammatory factors in the analysis. Conduct a microbiota study because it has been shown that having a strong microbiota will logically help reduce inflammation and provide good protection against all the changes that arise with hormonal changes during in vitro fertilization treatment. If there is insulin resistance, hyperestrogenism, or hypothyroid alterations, all of this needs to be analyzed, including how vitamin D levels are and whether there is a metabolic syndrome. This is what we are going to see in a patient, for example, who comes in because they are undergoing some fertility treatment. It is an example of a clinical history that we need to create. How are we going to do the dietary record? Has the entire hormonal aspect been discussed? Or has the entire clinical aspect been addressed, which needs to be tackled? First, I divide that hour, those 60 minutes with my patient. The first half hour is the clinical part, and the second half hour is for the dietary record. And then the guidelines, since they need to be personalized a lot, I will provide them at another time because I have gotten to know the patient, and then I have to create that adapted diet. So when we want to make a dietary record, we need to know where they eat, with whom they eat, meal times, if they have trips, okay? And to review their day by hours and intakes, okay? The 24-hour record does not reflect the actual intake, meaning that if I ask the patient what they ate yesterday in 24 hours, they will not tell me their eating pattern, okay? So I have to ask them about each food, frequency of consumption, that is, how many days a week do you consume legumes? How many days do you consume fish? How many days do you consume meat? What do you consume? What do you not consume? Allergies, intolerances, your preferences, and the consumption of water and other beverages. You should always assess the frequency of consumption and review the day, going through all the hours of the day with the patient. What time do you wake up? What time do you have breakfast? What do you have for breakfast? Do you always have the same thing for breakfast? Do you change it up? But for me, the frequency of consumption, if you want to have something that can be filled out quickly, a dietary record, then this would be a way to do it quickly. To say, meat consumption is occasional, frequent, never, almost daily, or other food, we are going to conduct the anthropometric study. We need to measure and weigh them and conduct a body composition study in which we measure fat, water, and muscle mass. The body mass index does not analyze body composition. so it does not provide us with much information. Simply knowing a weight for a height will tell us little. Two people with the same weight can have completely different percentages of body fat and muscle mass. And in the end, we really do not know how its composition is. For me, it is a piece of information that is not very relevant nowadays, thanks to the many techniques we have to analyze body composition more thoroughly. Here is what I say. BMI can lead to confusion because, in the end, the percentage of body fat varies greatly from one person to another. Then, of course, it is important to know that the percentages of body fat in women and men are completely different. Women have much more fat. Women will have between 20% and 30% body fat, while men will have between 10% and 20%, although this varies with age and differs in female athletes. A female athlete can have 17% body fat and be fine because ultimately her fat values are much lower, and a male athlete, well, I have seen percentages of 7-8%, especially in elite athletes, and they are also within the normal range, okay? But because in the end they have, as I say, a very, very, very intense activity, and their body fat percentages decrease, the important thing in the end, especially for women, is to see that this percentage of fat is healthy and does not disrupt, for example, hormonal levels. In other words, she has her menstruations normally and does not have any type of hypothalamic amenorrhea due to the lack of her period because of that very low body fat percentage. If you eat well and your body fat percentage is simply because you exercise more, then we are within optimal percentages. So, well, it's good to know this. Now, how can we conduct the body composition study? We can do this with a skin fold caliper study, where we will measure all the skin fold fat folds using this little device you see here, which is the caliper. And well, this can be done. It takes time. I usually use bioelectrical impedance more in consultations because it is faster and because we have a fairly modern device in the office that helps us analyze it. It is true that sometimes it fails because, depending on body water, impedance ultimately represents electrical resistances. It is an electrical current that measures the resistance of different tissues to the flow of energy and sometimes indicates if there is significant fluid retention or if there is considerable inflammation at the intestinal level, which may lead to some errors. However, in general, it provides data that over time becomes relevant. Then there are more sophisticated techniques like DEXA, CT scans, and MRIs, which are available in high-performance centers and others that have them. The bioelectrical impedance method, as I said, is based on electrical resistance and measures the resistance that different tissues exert to the passage of energy. Greater resistance indicates a higher percentage of body fat. And it conducts a study like this. This is the typical study I have in the consultation, where it analyzes on one hand the weight. For example, in this woman who weighs 50.9 kilos, she has a fat mass of 20 kilos and a fat mass of 13.6. And then below we see that the fat percentage is at 26.8. It is within the healthy range, but we see that there is a pattern where muscle mass needs improvement, okay? Because it is quite low. Then it also measures us segmentally by parts of the body, arms, legs, and trunk. We see that it is well balanced in all parts, but we would need to gain muscle mass. Below, we have a control, a balance of what we should aim to gain, which would be at least 3 kilos, 3.5 kilos, and there we analyze a bit the changes we should expect when implementing a nutritional approach. It also analyzes body water. It is very interesting that the impedances differentiate between intracellular and extracellular water, and then also analyze the percentage of muscle fiber differently from water in the muscle, because in the end, muscle glycogen contains a lot of water, and this can sometimes alter the measurement of the percentage of muscle mass.